we are now turning to the most exciting time of this call, and that is Q&A. So for those of you who've been listening this whole time, make sure you, unless you're ready to talk, mute the bottom of your screen. So if you scroll down, move your mouse to the bottom of the screen, you hit the mute button, because we're about to unmute all of the lines. This is a wild proposition, a provocative idea on its own. So Amanda is going to try to unmute us all, and if we hear a bunch of noise, wild background noise, we might remute you, so give us a second. But whoa, Amanda just unmuted a whole bunch of folks, and I don't hear all kinds of noise. So I'm just excited. So at this point in time, if you want to ask a question, you can just ask a question, or you could raise your hand in the participants area of WebEx. And I'll turn it over to Carrie to start the Q&A and lead us through it.
Yeah, I think we had a couple of questions that had really good answers on the chat function. So if, those of you who had questions, Deb Washington gave information about pediatric notes, adolescent notes. There's some good information about behavioral health notes, and also about how to prepare doctors. So based on some of the questions that we had. Deb, did you want to add anything besides those great links?
Just there's a lot more information on our website, so feel free to look through there and also reach out to Liz or any OpenNotes staff for any more information you might need.
Yeah, and somebody asked if we were going to be sharing the presentations, and the answer is yes, as well as a lot of other great information. Liz, when do we send those out?
We're recording this call. Amanda is going to take the call and chop it up per presentation, which gives her a day or two. So whenever, no pressure, Amanda, but whenever Amanda's done with the editing of the video, we'll send an email out with links to all of the videos, a PDF of all the slides, as well as links to resources mentioned during this call.
Great. Any questions? What's the top burning questions out there?
Can any of the presenters speak to experience with non-English speaking populations?
That's a great question. We had a discussion about that in the last consortium call. If you remember, we had Anshu Abhat talking about using OpenNotes with kind of a variety of populations, and we have that link to her talk, as well as anyone. Gil or Marlene, anything you wanted to share regarding language appropriateness, language?
Yeah, hi, it's Marlene from San Diego. So we are definitely, our MyChart already starts with some language limitations. We do have a lot of caregivers that are on the MyChart, and we of course have proxies. So I have a lot of Spanish. I actually speak Spanish, so I have a lot of Spanish-speaking patients. And my notes, of course, are in English, but actually one of my better readers of their notes is a Spanish patient and their family, because they can't always all be at the clinic. So it depends, I guess, how you have your MyChart set up, but of course, remember, it's not, your notes in English. So there is a translation level there. But as long as they have MyChart access, and we have a Somali patient, we have multiple different nationality patients that we share all their notes in primary care.
So this is Steve O'Neill. So I just would add one other thing with a lot of our non-English speakers. It's always been an issue in therapy, just trying to do therapy with an interpreter, and it works. We make do with what we have. I would say there's one other aspect of all of this that actually has been helpful for a subpopulation, and I think you probably have a much larger population there in California than we certainly have here in the Boston area, and that is some of our non-documented persons that we see. If they have to leave, one of the advantages of OpenNotes is they can, if they move someplace else or they have to, uproot themselves or whatever, they can access their notes no matter where they go without having to then leave an address to have a medical record forwarded. So there's a little bit of an effect, I think, that's really been a blessing in that regard.
Yeah, I can comment that our portal allows patients to choose their primary language of English or Spanish. What it does, it changes the headers, the links, and the subsections information. The actual radiology reports, doctor notes, lab results, are in English. That's how they're stored in the medical record, and patients receive exact copy of them. What do patients see in the patient instructions? So when they look at the visit summary, that depends on what their provider entered into the document. So English and Hebrew, primarily speaking providers like myself, will use these languages. And if someone wants to enter a Spanish or any other language, they will either use an interpreter. I know that some even use Google to help with simple translations, even though it's not certified. But patients will read what's posted for them, and that's up on the provider to determine that.
Gil, since you're talking, I think it was Miriam asked the question. No, I'm sorry, Amy asked the question. Can secure notes be accessed by patients via a medical records request?
Right. So a secure note in Cerner is not a metadata on the note itself. It's an actual document type. And what most organizations do, they exclude this document type from the automatic release of information. So to understand the process, patient requests a full copy of the record. There is a template that will pull in progress note, admission H&P, discharge summary, lab results. It doesn't automatically pull into the PDF they get anything that is filed as a secured note. That requires manual review by medical record staff that have to follow federal, state, as well as hospital policies and regulations in determining what content can be shared with what recipient. Patients have the right to receive a full copy of most of the information. Typically, secure content may require additional authorization. If it's behavioral health notes, they may require the therapist or the psychiatrist to authorize the release, and 99.9% it's going to be authorized. There are different types of content that may be filed as a secure note. It just says that there is a human being vetting what will be shared with a paper-based release.
A question that came in from Miriam, and this can go to Gil, Marlene, Chris. She asked, was there any training for providers on what not to mention in the notes before going to OpenNotes, or just general best practices?
So the OpenNotes website, and there are other resources with some generic recommendations that I think will help everybody. I used to tell my colleagues, I still do that, write it the way you want an ER doctor like myself, right, will understand. Don't make it more complicated than what I can understand so your patients can understand that. These guidelines or some documentation recommendations were shared with every memo that was sent out, sharing what Marlene said, that not everybody reads their messages or memos from the CMIO or the CMO or the CIO. We took a long time to communicate. The communication came through department chairs, clinical department administrators, chiefs of staff, chief medical officers, myself. So just repeat messaging. We also held several Q&A sessions in each location. We had participants from risk management, legal, medical records, patient experience, informatics, brief presentation of recommended language, what to say, what not to say, focus on the mechanics. How do you choose a document type, or how do you choose a secure note type? And then Q&A sessions to allow the different providers to learn and ask questions. We also had similar sessions with staff, because as you can imagine, clinic staff and hospital staff have questions and interact with patients a lot. So we wanted to make sure everybody understands the mechanics as well as what to do.
So hey, this is Marlene. I'm impressed. That's a lot of help. We didn't get quite as much at UCSD. We did create a website that we advertised out that had great links. We definitely utilize, and I highly encourage everyone to utilize OpenNotes content. It's wonderful. There's great videos. I think using that and creating our own website where we can link it really helped. We created a tip sheet for the EPIC side just so people knew, it's pretty simple, like here's a picture and here's how you unshare the note when you don't want to share it. So it was pretty straightforward on there. And then in the primary care areas, which were automatically sharing the notes, we did, I did come and give talks to a couple of the areas. And the basic thing I said is, don't write anything in the note that you wouldn't tell the patient. And if it's something that you do need to write that you don't want the patient to see, then don't share the note. But I have patients, I think I use the keyword talkative. So if you see that, you'll know our secret word. And that just means the patient might be a little bit, hyper or manic or something is a little bit different. And that helps me or other docs know a little bit. But, if the patient has like psychiatric illness or things like that, I'm going to tell them. If they have alcohol abuse, I'm not going to put it in the note and not tell them. So I think one of the things that we concentrate on is just making sure you communicate what you have in the note. We didn't really tell people to write their notes differently. We just worked on the communicating what's in there. And definitely big thumbs up on the OpenNotes website.
Amanda, is anyone raising their hand in the WebEx that's waiting to be called upon?
I don't see any raised hands.
If there's anyone with their audio on and you just want to ask a question, that's totally fine.
There's really great questions and really great answers in the chat function. And I think, Liz, we need to share some of these great links. So I think we'll talk about a way so that I think it all goes away once we end the call, but there's really some invaluable information there.
Absolutely.
There was some discussion about adolescent.
Hey, this is Anshu from LA County. I have a couple questions. So this is really great. Thank you, everyone, for presenting. One question was on the mental health side. Do you have recommendations for facilities who are not live with mental health? So, for example, in LA County, that was one thing we couldn't really convince providers on when we went live last year. So do you have any advice on how to then restart that conversation?
So I think it's just, as one of the, as Chris pointed out, once you have peer review literature out there, that helps a lot. What I would say that one aspect to do is to keep going back with them with the growing literature in this area about the benefits of it. And I think that's, that's one of the things that people are naturally skeptical about opening up mental health notes. I think it's an understandable worry and concern. And I think that they need to see that, in fact, actually those fears can be allayed and the worries can be addressed. And just as, Marlene mentioned about, the most important thing is oftentimes one of them is to make sure that whatever you're going to write in your note was communicated to the patient. That's generally, by and large, what patients don't want to see. They don't want to feel ambushed by something that was a surprise. So the more we treat people respectfully and as if they can handle things, the better off they are. But I think the literature is actually part of what helps a lot of folks to kind of move the dial in terms of faculty and other folks that are physicians. They need to see that.
And one quick follow-up, a point of correction was that when we, the summer before, we actually started allowing patients to go to MyChart to get PDFs of their chart. I think a lot of you probably have that if you have Epic, but we were amazed, like every month 1,000 people would download their charts, would get their charts. So that actually helped me when docs were like, no, I don't want to share my notes, especially, we do actually have some psychiatrists that share their notes here. And, as long as if the note's not sensitive, it's going to be released when they do the release of records. So I think that's, excuse me, something important to keep in mind is that patients currently can get those notes. And so if you kind of use that when you're talking with people, that helped me talk with people.
I'm curious if, so a person who works for OpenNotes, who also is a co-chair of the California OpenNotes Consortium, I'm very aware whenever a new publication comes out about research around OpenNotes in a variety of aspects. Steve even mentioned he called it the recent article by Steve Jobshaw. None of you probably know what that means. Steve Jobshaw from the VA did a paper about opening up mental health notes in the VA. And I'm curious if this group would find it helpful if whenever a new paper comes out, I just send a 3-sentence email with a link to the article, or I'm just concerned about over-emailing you all, but it might be helpful for you to know that there's new papers out there. So that's just a thing for folks to think about, and let me know in the chat if that's helpful.
And he has about 5 or 6 articles out now at this point.
Yeah, we're getting towards the end of our time. Any last burning questions before we add some headlines?
Hey, this is John Santa. Could I make a comment?
Please do.
Sure, John.
Yeah, things on the mental health issue. Those of you who have Cerner and have delayed mental health have a challenge because when you add any other notes to be shared, it goes back to the start date. I actually just heard today from a Cerner organization who has been lobbying Cerner to change that. That they're now getting some willingness by Cerner to change that, so there's opening those notes won't go retroactive, which is a big problem. So those of you with Cerner, I think, could continue to lobby them to enable some flexibility around that start date issue. The other aspect is just an anecdote. A colleague was telling me about a conference they were at, and the topic of OpenNotes came up, and a questioner asked, well, what should we do about the mental health? At the University of Michigan, they included mental health notes, and the chief of psychiatry was there and spoke up and basically said, we included mental health notes right from the start, and that's because we thought to not do so was stigmatizing mental health. And I think in some respects it may be time for some of us to be a bit more aggressive with the mental health community and confront them a bit about what they're doing that stigmatizes their patients.
Thanks, John. So we have 3 minutes left, and before all of you start dropping off when you hear a ton of ping, ping, pings, just know, yes, we will be sending a link to the recording. We will be sending a link to download the PDF of the slides, as well as resources mentioned on this call. I want to quickly mention 3 things that are unrelated to this presentation. First slide, we had a new paper, we're calling this breaking news. New paper came out from Virginia and Commonwealth University, where they kind of conducted their own OpenNotes research about what happens when patients read their notes. It's really exciting, interesting, and I will make sure you guys get a link to this. Next slide. What is my next slide? Oh, we want to mention that Rochester, New York has 2 competing health systems that are huge, and they decided to partner to roll out OpenNotes together at the same time. Sometimes the patients receive care at both places, sometimes not, but these 2 competitors made this a big thing. So they're the first community-wide implementation of OpenNotes that we've seen before. Though I would say San Diego and LA area are kind of getting close since there are a lot of folks sharing notes. Next slide. I just want to, for those of you who might be policy nerds, go look for this. It's the state of California released, the Office of Planning and Research released a precision medicine action plan for California. And it specifically, click next, the action plan makes this huge recommendation that to require vendors who are serving those in California to provide imaging and clinical notes to patients, i.e. OpenNotes. And so just thought that was interesting, and I'll send a link out to this report as well, especially for those of you at cancer centers or doing anything around precision medicine, you might find this interesting. And then I think the next slide is just to remind you, we have our next call coming up either late March or early April, and what's going to be different about this call is it's going to be a little less presentation heavy and spend a lot more time on this Q&A period. So please contact me, please email me if you would like to present something, or maybe even use this as an opportunity to ask the community what struggles are you dealing with so we can learn from each other. Because OpenNotes is all about culture change, and you guys are changing culture, so for the rest of us, patients like me can benefit in some way and actually have access to our health information. And Carrie, I'm not sure if there's anything you wanted to say at the end here, but I just want to say, just remind you all of the words that I got to read earlier from Leah and how important this is for patients like her. Yeah, and that's our contact information. Carrie and I tend to stick around a few minutes after as you jump off, but if anyone else would like to ask more questions, we'll be here. So thank you all for joining us today. And thank you to our presenters for presenting.
Thanks, Liz, for setting this up.
Of course, thank you.
Thanks, everyone.
Thanks, Steve.
Hi, Stephen.
The mass exodus of WebEx. Beep, boop,
Are
beep,
you
boop.
counting the beeps?
I can't.
Terry, it's Bill Stroll, and hi, Liz.
Hey.
Hey, Bill.
I just enjoyed the meeting today, and also wanted to just comment that I recently had a chance to speak with several leaders in KPMG, Northern Cal, Kaiser Med Group, and never received as, unfortunately, negative a response to anything I recommended or just linked them to as with this. So it's frustrating. So I was wondering if you have any suggestions, and or if you have at least maybe 5 recent peer review articles that you could share with me that I could share with them.
Yeah. Yeah, to put a package together for you, Bill, with those articles. And then I don't know if this is helpful or if it's something you might, well, I feel like I should let Carrie talk because you guys are colleagues at Kaiser. But in Marlene and Chris's presentation, they talked about the concept of bringing some folks to OpenNotes to their leadership to make a presentation. I don't know if that would help Kaiser in some way, but we could pull something like that together if you think it would help make a difference.
I think at some point that would be helpful because I haven't gotten very far. I've just basically been told that senior leaders know about this. They are not interested. They consider the hornet's nest. And so I don't know what to do with that except to say that I'm disappointed and share good peer-reviewed information.
But I know other big organizations refused until they changed their mind and are now embracing it. So it's just a matter of they haven't changed over yet. And, the world's moving in that direction. So we will get those hornets addressed. And
exactly. Well, that's my goal before I retire. But I mean, in fairness, I was also told there's a lot of other things on their plate right now. The timing isn't right. There's a lot of things on physicians' plates. And I tried to say, but this is not as big a deal as you think it is. It's just not. It's a win-win. But I couldn't really get past that first set of reactions.
It is going to happen. It's just a question of when. That's all.
Bill, there's a couple of patient advocates who are Kaiser NorCal patient advocates that actually were on this call for a good chunk of the call, who are on the call because they want access to their notes. Some receive care at 2 places and can see their notes at Stanford. Some can see their notes at Sutter and Sacramento area, but don't have access to their notes elsewhere. And so I don't know if it'd be helpful for them to hear from, the OpenNotes folks on the academic side or from patient advocates and what the right strategy is, because it seems to be different everywhere. Every culture is different.
Well, I would imagine if they were half as articulate as the person whose note you read earlier today, and they addressed that to some senior leaders in Northern California, that could be very influential. They
are rock stars.
I would imagine if they're interested in this.
Better to a top KP leader, has done a lot in the organization. So it's just a matter of keeping it up and persisting and not giving up.
Yeah.
Yeah.
I noticed there's a couple other folks who may either still be on the call or just they haven't closed their computers. And I wasn't sure if Shoba or others are on that wanted to ask questions as well. Maybe not, but I just thought I'd ask. Okay, we can continue chatting.
Run to the bathroom, yeah.
Yeah.
Yeah, I see some good friends on the call.
Absolutely.
And Liz, so it looks like I'm going to be flying on March 26th.
Right, we'll figure it out.
Yeah.
Hey, Liz.
Yes.
Oh, hi. Sorry, I didn't realize I was still on mute. I just wanted to see if any of the presenters were still on the call, could talk about any challenges with the pediatric population in kind of getting buy-in with things, or any challenges after the fact.
Let's see. So on this call, I'm not sure if John Santa is still around. He's our Director of Research Dissemination and has talked to pretty much every children's hospital in the country. John, are you still on? If he's not, yes, John? No, okay.
Looks like he dropped off his audio.
Oh, no worries.
Okay. And then I do, well, yeah. What's that, Carrie?
Is this Shoba?
Yes.
Shoba, we could connect you directly with others, kind of like we were doing around the mental health space, and be happy to do that. Actually, did you get to talk with Chethan Sarabu at Stanford Children's?
Yes, I did when we all met here in San Francisco. So we talked. Yes, I did. I just wanted to hear any other additional anecdotes or anything people had, but it sounds like no one has had any major issues.
No.
Did you see from Deb some information from OpenNotes organization about pediatric? She sent
I think Steph is on the question.
Oh, yes. I'll get to Steph in a second while we're
yeah, that's okay. You should finish up.
Oh, not sure who I'm responding to now. So yeah, Shoba, I'll make sure you're connected with more folks at Stanford Children's, and then maybe at Rady Children's too, because I don't think you.
I talked to them when we all met. I just was curious if anyone was still on the line, just of any anecdotal experiences. But I did talk to Chethan, and then I talked with the CMIO at Rady's, and she was great. Yeah.
I think folks are like, well, hasn't someone had a problem? Tell me the one.
Yeah, that's what I'm looking for. Yes, exactly.
And honestly,
I haven't found one yet, but
yeah. Have you talked to Fabienne Bourgeois at Boston Children's?
I read the paper that everyone's been sending around.
Okay.
All right. But I haven't spoken with him directly.
You have officially spoken with everyone. I know that Seattle Children's is in the process of about to go open, and so I think folks might like to, kind of like with Bill's presentation today. He was a more recent open noter, and so it's like, if someone's going to have something wild go down, it's got to be a new person. And Gil's like, things are cool. All's going well.
Right.
And maybe I could do an email, like I could check with the Seattle Children's folks and see where they're at. It could be they've launched and haven't told us about it, which is quite common. And then we're just waiting for them to follow up with us. So I'll just find out what's going on at Seattle Children's, and if there's anything, I'll let you know. Otherwise, and if there isn't anything, I'll let you know. Either way, I'll let you know.
That sounds great. Thanks.
Marlene commented that Rady's in San Diego is on because she could see her own kids, not as a clinician, but as a parent.
Yeah, and I talked to the Rady folks. I mean, they're doing adolescent too, which is, I think, separate from the pediatric issue. Like the pediatric, under 11, because they're sort of the proxy population, and then the adolescents. And I've gotten a lot of questions about that, so I'm just curious. But like Liz said, I'm looking, and I haven't found any problems yet.
Will you, when you officially start sharing notes, will you share that story about how you've looked for all the problems and couldn't find any, and then you launched? No.
Yeah, sure. Yeah.
Okay.
Yeah,
okay.
absolutely. Yeah.
So I want to make sure we get to Steph Lee, who's been waiting. Steph, are you still there?
Oh, yeah. Hi, Shoba.
Hi.
So I snuck in the last half hour because I got excused from my other meeting. So I'm sorry if I missed this, but I don't know. So earlier I heard something about like secure notes not being disclosed, like if a patient requests their medical records. Do you know if that applies to sensitive notes?
Oh, so secure notes is a Cerner terminology. So
how is that?
It's just how they've set up their EHR. It's just a note type. It's nothing.
Right.
Yeah.
Do you know if that's the same as like what our sensitive notes would be like? Like would our sensitive notes be screened and not opened to the patient if somebody were to request their medical records?
No, people have access to.
They would still be
their medical records. Yeah.
Okay.
Yeah.
That's one of the arguments against not going to OpenNotes, where people say, well, what about people who have a domestic violence situation or something like that. And unfortunately, right now, an abuser could, demand that the victim get their notes, to look for them, and there's no protection there. But you may want to talk to your HHIM committee or information committee. Sometimes there are ways, like it sounds like they have in HEC USC, where there is a level of review. I think at Kaiser Permanente, I think anybody who asks for their records gets them, is my understanding.
Mm-hmm. Okay. My understanding too, in talking to these folks, there's no legal barriers to it. Like some people do it out of like courtesy to not put in certain things, but by right they have the right to it. I think legal. I don't think there's any regulation, that allows to withhold or whatever. So,
from a patient experience perspective, because that's mainly what I bring, as a person who's done a full medical records request and who tried to ask for all of my notes when I moved from Kaiser to UC Davis and UCSF, not because I don't like Kaiser, but just I had to because of insurance reasons. What they ask you on that form, which I believe it's pretty much the same form anywhere you go, is they say what date period do you want you to request your records from which clinician, which aspect. I said I want all the notes from all the providers. And then, but I didn't specifically call out like any mental health experiences, so I never got those notes. So I think these forms they're designed as such, you have to be very specific. And so if somebody's saying I want my medical notes, but doesn't call out, say, like a mental health aspect of their notes, we just don't get them unless we specifically ask for them. So I think if the concern is, what if they read the notes, oh my goodness, and then, oh my gosh, what if they do a medical records request? They would really have to ask for those specific things. So you're dealing with like a really rare person who's going to go and dig down deep. And
I want my secure notes only. Right?
Yeah, like I'm looking for those secure notes that were hidden from me that I had no idea were ever hidden. We wouldn't know to ask.
Yeah.
Got it.
All right, I've got to step off now to another meeting, but
you're busy?
Thanks so much, Liz.
Okay. Thanks, everyone.